Welcome to Art Toronto. My name is Mia Nielsen. I'm the director of the show. Today, we're going to learn about the role that art can play in healthcare through a panel discussion called Art and Care. This is Healing Mind and Body with Creativity. It's moderated by Medcan's Shaun Francis. We have Dr. Lesley Wiesenfeld, psychiatrist in chief at Sinai Health in Toronto, along with Diane Brown. She's the founder and president of RxART. Artist Marcel Dzama and Stephen Legari from the art therapy program at the Montreal Museum of Fine Arts. Enjoy.
Hi, it's Shaun Francis. I'm the host of the Eat, Move, Think podcast and the CEO of Medcan, a Canadian health and wellness company. And I'm delighted to be taping today with a group of collaborators who have a deep interest in the arts. Medcan, for many, many years, has been building a contemporary art collection, mostly profiling Canadian artists. And we've been collaborating with Art Toronto on getting the word out on the work we're doing with Canadian artists. And so we're really delighted to be here today in collaboration with them and their platform series and the collection of art experts with respect to health from a variety of backgrounds that we're able to curate and bring to you, and who you will hear from momentarily. Let me just give you their background. So I've got Dr. Lesley Wiesenfeld, she's the chief psychiatrist in chief at Sinai Health. And Dr. Diane Brown, who is a clinical psychologist and the founder and president of RxART, a nonprofit organization that collaborates with artists to transform the walls and decor of children's hospitals. I also have Stephen Legari on the line. He's the head of art therapy at the Montreal Museum of Fine Arts, and he's currently the world's only art therapist working full-time in a museum. Last but certainly not least, Marcel Dzama is here. He's a renowned contemporary artist whose works can be seen in collections all around the world, and he's also teamed up with RxART. So welcome everyone. Again, thank you for being with us. Let me kick it off the top here with Lesley, Dr. Wiesenfeld. For our listeners, it's what are the benefits? I mean, at Medcan, we often talk about the evidence-based benefits of different therapies, and maybe you could kick us off with what are the benefits, perhaps both of having art installations in healthcare settings and actually art therapy, and perhaps what is art therapy?
Oh gosh, I'm going to tell you what I know, and actually tell you also that I'm excited to learn from some of my colleagues who actually are more deeply trained in art therapy, because I think in many ways, my own kind of entry point, both as chief of psychiatry, but more importantly as part of Sinai Health, has been to try to think about how we can learn from what more deeply trained art therapists and artists have been developing around intervention, so that we can think about what we can bring to our spaces. So I think a few things that may sound very simple to my colleagues and with their deeper training is, what we kind of know is that the environment in which people receive care makes a difference, both their environment in terms of what we might call the passive environment, what it feels like, what it looks like, the degree to which empathy kind of is expressed by how much care is put into the environment. So I think we probably all had situations where we can just sort of tell by how a room feels, or how a waiting room feels, or how a patient room feels, that it didn't just happen to become that way by accident, but people who actually know something about color, about space, about tone, about light have had some influence. So I think in many ways, my sort of beginning shortish answer would be that art, in the same ways it leavens and invites people to have a different kind of experience in our kind of civilian life. When we're patients, we're still people, and we're people going through stress and strain. And so being able to have an experience of something that is either beautiful or, leavening or engaging or distracting even from what the tension might be, as we're also acting as sort of patients or caregivers, gives us a way to feel differently when we are in a situation where we're under usually a mixture of strain and worry and in need of something that feels able to make our healthcare experience better. So, we at Sinai, we've been interested in developing our program in part so that people will have an experience that feels designed to provide some better health, even kind of beyond the usual ways we think about just sort of biological interventions or even psychological interventions. So, those are my thoughts about where we're starting in the hospital setting and in the healthcare setting. I think what we're hoping to do is also learn from our patients about what is their experience so that we can develop even more in terms of the built environment and some of the programming that we do.
Thanks, Lesley. I want to ask Dr. Diane Brown. Diane, you're also a clinical psychologist. You founded this organization, RxART. Maybe you can just tell us the background of that and some of the impact it's been having.
Sure. I'm sorry, I have to correct you. I'm not a doctor, and I'm not a clinical psychologist. I started RxART in the U.S. 21 years ago. I have my background. I was pre-med, but never got a doctor. And my background is really in the arts. I had a gallery, and then I was a private curator, and then I began RxART after an unpleasant medical experience. I wanted to get out of the room, and there was no escape. My only escape was my imagination. So I imagined an artwork going across the ceiling, and it completely calmed me down. And I decided I wanted to do that for other people. ArtTO has grown tremendously since that day, and RxART Canada, we're really proud to have begun. It's quite new, it's a few years old. We've done a project at Sick Kids, and we're in the midst of a fantastic project at St. Mike's with Marcel Dzama that we're extremely excited about. But our mission is to transform hospital settings for children so that they're not frightening, so that they're filled with wonder, spaces of imagination and comfort. And we like to challenge kids, families, but in a really positive way. Just give them something that's a bit unfamiliar so it takes them out of the hospital setting and makes them examine where they are or what they're seeing.
Thanks, Diane. And thanks for that clarification, by the way. Let me turn over to our artist, Marcel Dzama, and talk about how did you get connected to Diane, and what's it like? How do you develop art in that sort of hospital setting?
I believe we met through maybe the coloring book. Maybe I did something.
Yeah.
For that. I think that's how we met. So there's a coloring book that raises funds for, or maybe everyone knows about it. And then she proposed doing a hospital, and I was happy to do that. My father-in-law was actually quite ill the last little while in the hospital, and my son and I, we filled the room full of handmade posters for him, and it just really changed his mood entirely. So I actually saw that firsthand, we even left seeds by his window, and gophers and birds came. So it's a very nice experience that way. Sorry.
Do you focus, Marcel, though, like with a space in mind? So, for example, does the space matter, and do you curate or create something very specific to that?
Yeah, the space mattered. The layout of the place had some sort of I think it was a pirate ship or something like that theme to it before. So I tried to keep that marine kind of feel to it, but I went instead of boat. I tried to go more underwater and have it more tropical and almost a little surreal on the side too. So it kept the kids more entertained than a normal seascape would. And then I tried to just also make it visually pleasing. So, and I used the dimensions that I was given from the room, and got to see the space virtually because of the pandemic. But normally I'd be there.
And I don't know if this is you, Marcel, but Diane, I saw on your website, it looked like even MRI machine or a CT scan had been painted.
Yes, the first CAT scan machine that we attacked was done by Jeff Koons, and it was hand painted. Since then, we've gone to wrappings like they do on buses and cars. So we have a vinyl wrap put on the CAT scan machine. We had one by Rob Pruitt and one by Takashi Murakami. Now we're in the midst of a really exciting collaboration with a firm that does imaging. It's called Nous Imaging, and it's a study that we're going to be involved in to put a video game inside the bore of an MRI, which is so exciting to keep the kids from moving so that they will be able to be in there less time and not have to be anesthetized. The game was explained to us as a little dog. They show the child a tablet, and there's a little dog with a thought bubble, and in the thought bubble, the dog is having a dream, and the child could watch the dream, but if they move, the dream stops. So they tested it with a 3-year-old little girl. I mean, they've done more than one test, but this in particular, they filmed it, which was really boring because she never moved. So now the Haas brothers, who we're working with on another project out of California, are making a video for the bore of an MRI. So this is really exciting to me. Well, everything I do.
It sounds like you're using different mediums. Does music factor into it at all?
You know, we have not used music, but I would really love to, because music has been so well documented as far as having a beneficial effect to people who are ill. It's just visual art. We know that you have reduced reduced amount of medication. You have reduced time in hospital. So these are all really great benefits, but music unlocks so much in the brain. I would love to go there. We're a tiny team, but I hope we'll get there.
I'm hand it over now to Stephen Legari, who's at the Montreal Museum of Fine Art, and you're the only art therapist in residence, I understand. Can you talk to us and our listeners? What is art therapy and different forms, and how did you get into this?
Gladly. Thank you for the question. And it's really nice to be with my fellow panelists. Nice to be having this conversation with you. I have my own little correction. Happily, I'm not the only art therapist working in a fine art museum. This strange phenomenon has started to spread. And I'm finding colleagues pop up in different parts of the world who are doing extraordinary work. So I don't want to pay their efforts, or even the people who pioneered this kind of work, a disservice by hogging all the attention. Art therapy can have some very simple definitions, or it's a complex one. I'll stick with the simple one for now, which is therapeutic accompaniment using predominantly the visual arts that allow people to externalize their experience, enjoy a therapeutic relationship, and feel supported as they're doing that, whether you call them a patient, a participant, or a client, depending on the setting. In a fine art museum, we get to add the museum's collection to that mix. And anybody who's collaborated with a gallery or museum knows the therapeutic potential of encountering the art on the walls, the art on the floors, the art in the galleries. And so that's where museum-based art therapy borrows heavily from a more clinically informed approach to art therapy, but then generalizes it to a cultural institution. That's a little bit about what my work looks like.
And Stephen, where do do you call them patients, clients, guests? Where do they what are they called, and how do they get introduced to your program?
At the museum, when they come to the museum, they're called participants, or just folks, and that's to give people also the empowerment to choose their identity when they come here. A lot of our programs are done in partnership either with clinical or community organizations, whether they're just down the street or they're across town, whether it's a major hospital or someone who's just been able to put some funding together and is seeking a partnership. So we have a huge history of community partnerships. And anybody working in the education department of a museum will see their efforts in what I'm describing. But we build these partnerships carefully, listening to the needs of our partners so that we can learn the needs of, if they're patients and they become participants, or their clients and they become participants. We take the time to learn the specific needs, whether those are mobility needs, whether those are short or long-term healthcare goals. And we see where the arts, the museum, as Dr. Wiesenfeld described, the setting has quite an impact on people's well-being. I'm in a fine art museum. I'm actually in my messy office where I haven't been for months at the moment. But the light, the sound, and the welcome, right? So that human aspect of feeling welcomed into a place where you get to be celebrated as an art maker and someone who has something to say about fine art, even if that's not your discipline. So that's how we build our partnerships. And we're fortunately on the receiving end of those calls a lot, whether we're working in psychiatry with people living with cancer, or our more community-based organizations that are seeking social connections for that social dimension of health that has become increasingly not only important, but urgent.
Let me, on that note, ask Lesley, what kind of, Stephen mentioned how people come to this program. Do mental health professionals refer into art therapy? And what kinds of conditions is it ideal for?
So, I mean, maybe just backing up a bit around context. So, we have some recreational and art therapists who work at Sinai Health, particularly in our rehabilitative medicine program, where we have a longer period of time to work with patients and clients, which probably makes sense to this group, that the longer time we have to think about how to apply some of the kind of deeper therapeutic approaches, the better. The work that we've been trying to do concurrent with what I would describe as, and Stephen will correct me, I hope, the more therapeutic arts approaches, is also to think about kind of an expressive arts approach where we're, trying to engage with people who may be admitted to our medical or surgical floors, maybe admitted to what we call our mums and babies floors, people who might be having a shorter period of time in the hospital where the focus may not be exclusively and explicitly a mental health purpose, but with a recognition, if I can indulge my colleagues, like all health is mental health, for sure, or there's no health without mental health. And so the way that, for sure I'm biased, the way that we think of it is whether you're someone who's broken your hip and happens to be feeling isolated and nervous on an orthopedic floor, or someone who's laboring on a mums and babies floor, there may be opportunities for what might be kind of a lighter touch and a lighter infusion, if you will, of some opportunity to think about using art. And so our approach, maybe just to give a slightly different answer to your question, Shaun, is to think about where are the opportunities where, in some ways, no matter where you are, whether you're a patient for 6 or 7 weeks on a rehabilitative floor, or a day, giving birth to your babe, or something in between, can there be something you can either see, or, to pick up on Diane's point, hear, music, performance, or something that we've been working on, which we're just about to launch, is a maker kit, which is the idea of really something being delivered to each patient that they can engage with, whether it's drawing, poetry, reflective art, exercise of some sort. So I think that the way that we've been envisioning this work, which is funded by a very generous donor, is to think about how can we bring arts to any number of patients, both in terms of expression as well as a deeper kind of therapeutic approach. So I think we're trying to think of it almost as how can we dose it in a way that makes sense for the particular person's way of interacting with Sinai Health. We have everybody from people who might be just sitting in our waiting room for a few minutes waiting with their loved one to get the MRI that Diane was describing, or we might have somebody who's admitted for many weeks or months, especially during the pandemic, who's waiting to go to another facility, who might not be able to have visitors, who needs a much more intensive approach to stimulation and engagement. So it really depends on, in some ways it depends on the person, what we might suggest or prescribe. And yet I think the flip way of thinking about that is it's hard to imagine someone who can't, through either visual or engagement or hearing something, or even passively being engaged by something, if they don't have other abilities, who couldn't be kind of raised up, if you will, by some experience, especially if we try, as we're trying to, as we launch some pilots, we're trying to think about how we can also get feedback, because we have a pretty wide variety of patients and people from different kind of cultural, educational backgrounds, in terms of wanting to figure out how we can make sure that it's accessible to everybody at the level of language, culture, experience. I'm learning. It's not an easy thing to figure out, but we're going to try to get some feedback from people around what works for whom as we go forward. So the specifics in terms of your question around who might be recommended art therapy per se might be a kind of smaller group, who might be struggling in particular with expressing themselves, either in their own mental health or their physical health, or related to a brain injury or other pretty serious injuries. But for the broader group of people, we're trying to find interventions that really just relieve some of the suffering that goes along with being a person far from home, in a hospital where you're trying to recover.
And does art or art therapy, but maybe more specifically art therapy, does it on a preventive basis, right, for mental health issues and or all sorts of cognitive decline, right? Like we've been told we should do crosswords and pick up another language if we want to stave off Alzheimer's, for example. Does that is there research like that on the creative arts?
Oh, goodness me. I'm going to keep deferring to Stephen and his greater expertise, but I am a geriatric psychiatrist by training, so wearing that hat for a minute, I would say that there's really good science to suggest that kind of the more neurons that you use and the more neurons that you connect, and the more ways you kind of stretch your mind to do things that are not your most acquired skills. So, this is why people get advice about, if you're left-handed, use your right hand. If you love crosswords, you should actually try a number puzzle instead. So, wearing my geriatrics hat and my kind of anti-dementia expertise, that there's certainly a lot of good science to suggest the more any of us, especially as we get older, can challenge ourselves, which is why I'm very badly learning how to knit. So the more we kind of challenge ourselves to stretch those parts of our brain, the better, including, I might say, for many people, they wouldn't feel so comfortable feeling connected to art. They might feel overwhelmed. They might even feel like they could somehow, not be up for it. I think art can sometimes make people feel self-conscious about having to produce art, or having to have an opinion about art, or having, to kind of engage. And so, I think that the approach I think many of us probably would take is to try to bring down the sense of worry and the sense that there's a right way and a wrong way, but more to have people be able to feel almost the way, we felt when we were kids, and we didn't have the same sense of self-consciousness, when we just got to make things and experience things without feeling like there was a right or a wrong. So for cognitive disorders, there definitely seems to be good science to suggest the more we engage in things that stretch us. I always say to patients, squint and imagine yourself doing something you can't imagine doing, and then do that. Get out of your comfort zone. For many people, that will involve doing something artistic for the first time in 50 years or 60 years. And so, yes, people would do well to engage in artistic activity, and frankly, they'd do well to engage in almost anything that is not their comfort zone, whether art, exercise, crossword puzzles, mazes. In some ways, it's anything that makes your brain hurt a little bit, but then doesn't demoralize you so much that you're not prepared to keep going. So I think those are the things that are good to do, including artistic activity.
Yeah. Stephen, do you want to chime in on that? What have you seen in your experience?
I have so little to add to that. It's such a beautiful description of the potential of art. And again, being an art therapist doesn't mean that I see everything exclusively through the lens of that particular form of therapy. I'm an advocate of people consuming the arts across their expression, and in the ways that feel good to them, in the ways that feel meaningful to them. And I love the idea of them also stretching us and making us feel challenged. But I'll just use I'll pay credit to a non-art therapy program here at the museum, where my colleague for many years has been collaborating with different organizations supporting people with dementia and Alzheimer's, coming to the galleries, having a talk, manipulating some clay, seeing whether or not some memories are elicited, and focusing on the relationship with caregivers. I mean, we can describe that in therapeutic therapeutic words or in therapeutic intent without having to call it an art therapy. And these programs work, and they work well. And that one was originally inspired by Meet Me at MoMA. So there's a long history of people who are experiencing cognitive decline of using the arts to their own ends and to their own means. Of art is stimulating. I mean, can I make that claim? It's stimulating. It wakes us up. It wakes up different parts of ourselves. Sometimes we're alarmed to find what parts of ourselves have been woken up by our encounter with the arts, whether you're sitting in front of contemporary dance, you're listening to an orchestra, or you're standing alone in a gallery. It wakes us up. And so I think that is one of the key factors in a good long-term mental health.
And Stephen, you mentioned that you're seeing more and more programs like yours with museums. Is it truly catching on, do you think?
It's truly catching on, and it has a longer history than we know, because often in our education departments, what we would have called community outreach or special projects or programs for accessibility or special classes coming through have a long, long history in many of our museums, both fine arts and not. And a lot of those programs wouldn't necessarily have got the press that the great exhibitions would have. But that's where a lot of the foundational work happened. It's none of this was creative in a vacuum. And if you look at things like the scoping review from the World Health Organization from 2019 on the arts and health, or you just take a survey of museums' websites and look what they have under education and accessibility. Every single country, every single city has something. It is a movement on the move, and I like to think that it's moving forward tirelessly.
Switching over to Diane, you focus on art installations, but building on Stephen, who's at an actual museum, do you see any future in actually collaborations on the art therapy and helping healthcare institutions delve more into this?
Absolutely. And we work with our therapists, I'd like to say, and child life people all the time. They have to approve our installations to be sure that they're not going to trigger anything negative. Because we don't claim to be art therapists, we're just not. We're art lovers. And one of the things when I started RxART that I was cognizant of was that teenagers are in pediatric wards, and we're strictly pediatric. And if you're a teenager, you're angry enough to be sick, but then you're up with the little kids. I mean, it's just horrible. So I initiated a coloring book by artists. And the artists, every 2 years, we do a coloring book. In fact, today I'm home because the coloring book is being unloaded at my office, 15,000 copies. And we're working on a Canadian book, which I'm very excited about. But each book has drawings by at least 50 artists and stickers and covered by one artist. And so if you're a little kid, you'll color anything. And if you're a teenager, you can look at great drawings. And honestly, people have called and said, what's the age range of this coloring book? It's 0 to 100. But yes, we definitely engage with child life, with art therapy. It's really important to be in conversation with them all the time.
Do you have issues getting artists to collaborate, or how top of mind is this in the art community?
Well, honestly, we don't have problems getting artists to collaborate. Rarely does an artist turn us down. We give our artists an honorarium, which is insignificant for an artist, and it's significant for a little charity, but we're just saying we so greatly appreciate your time, your talent, your generosity, and then we pay off fabrication and installation. But the artists do this really, certainly not for the money. They do it because they know that they're changing a child's experience in a positive way, and how awesome, right?
Maybe Marcel, that's an opportunity for you to chime in. How's it felt for you, and has it changed you in any way?
Yeah, I mean, I'm deeply honored to be asked to do it. So, and I remember sitting in hospital rooms as a kid and just being, bored out of my mind and nervous. So, anything to kind of make a kid feel better or any patient feel better, really. Even the parents, I'm sure, enjoy being in a room like that. So yeah, I think it's a great program. So I was always honored to be a part of it in any way.
And how much time does it take? Like, if you're talking to other artists who, have to also make a living, how much commitment are they from a time investment are we talking?
It's such an interesting installation to work with. So I don't know if I even kept track of time. I made drawings that I could use for giving to my son or give them to a charity. RxART. So because they're going to be reproduced as what's the thing called, some kind of sticker kind of put on. I'm sure there's a word for it.
Wallpaper?
Oh, it's just a wallpaper. Okay, sorry.
Which you could use over, which may not be limited to one installation, right? I mean, they end up having a print-in effect that could go in other children's hospitals.
Yeah, that'd be really great. So, I mean, this one I work for this space in particular, but I think it could work with others. So that's one great thing about it. Yeah.
Can I intervene?
Maybe,
Can I?
Diane, maybe GE to do a deal with you for all their pediatric CT scans.
We sure wish they would, and we've tried, but we'll keep trying. If GE's listening, we would love to work with you. But I want to say about the artist's time. The artist puts so much time into these projects. I mean, it always blows my mind how generous they are with their time, with their studios. They work so hard to make these really meaningful installations. So I'm endlessly grateful to every artist that works with us. And Marcel, it's such a privilege to work with you.
And Diane, do you also work? I mean, different medium. You talked about different mediums in the AV experience in a machine, for example, which strikes me might be people with a technology background. Sculptures too. Are all mediums welcome?
It depends on the hospital and the situation, but we're doing our first sculpture installation actually in Washington, D.C. at Children's National. It's by the Haas brothers. It's going to be a 14-foot tall palm tree with a crazy monkey hanging from it. The monkey is beaded in South Africa by these women that the Haas brothers met and realized they were doing beaded bottles and getting paid so little. So they employ them at a much higher rate to do beading of these little animals that they design. And they give them quite a lot of creative freedom. So sometimes they'll submit a design for a monkey and it comes back nothing like a monkey, but they love it and embrace it. And the palm leaves are beaded by other women in Lost Hills, California. So it's a huge project that is for the new entrance to Children's National. Sculpture is really a challenge because you don't want kids climbing on it and falling off. One of the things we had to concern ourselves with was a base that kids couldn't climb easily. But that's fun. I mean, every project has different challenges. So Dr. Wiesenfeld, to your point, I hope we're keeping our neurons busy. Yeah, but we're getting into AV. So, I mean, we're interested.
Photography?
Yes, photography. We've done photography projects. Certainly we use photography in our projects. There's nothing really off the menu except something that won't be safe or will be disturbing. But we're happy to try everything new.
Kudos to you. It sounds your efforts are ever expanding international, which is amazing.
It's so much fun. We feel super lucky to get to do this every day.
switching back to our clinician team, art is something, and this is of interest maybe to the entire panel, but it's something that we may all take at some level in grade school, and then stop, other than the artists among us, really stop doing, and then only perhaps get back into it in this hospital setting. And it does sound like there's a lot of therapeutic benefits to it, both if you have some mental health issues and/or you want to expand the creativity side. And I know there's clinical evidence, that shows meditation and other sort of positive wellness habits, whether it's crosswords or proper amount of sleep, really do affect brain health. But do you see a future in, or like, do we have to wait until we're in a hospital setting, or we meet Stephen on a museum tour to get ourselves back into art?
Oh boy, it depends on which one of us unmutes ourselves first.
Yeah.
I mean, I think even, and many people have said this better than me, I think even the last 18 months of this level of restraint and constraint that so many of us have gone through, I think so many people have spoken about how, they've been trying new things. They've been thinking about notions of mastery, and also going back to what I was saying before, notions of being able to tolerate not being able to master something, which I think for many of us, not like Marcel, of course, but for many of us, our last experience, speaking for myself, with art, is being able to tolerate not having it be the thing that I'm destined to do, and to think about what it means to be creative, and what it means to express yourself, and what it means to have some relaxation, even if it's not about the final product. Which maybe when we were all kids, we all had different teachers. So we maybe benefited from a teacher who helped us, or felt like if you didn't draw the tree the way you're supposed to draw the tree, then you didn't get a good grade on the tree. So I think to your question, Shaun, I think that, there's good support for the value of developing habits that are about both mastery and tolerating absolute mediocrity at something. So in other words, being able to engage with something without having it be about the goal, but more about expression, and more about what might kind of wander into your mind or wander into your thinking while you're just trying to picture how you represent something, whether it's poetry, whether it's photography, whether it's a drawing. So, I think again, in our hospital, the work that we're trying to develop, although we do hope that it helps with people's recovery and their overall mental well-being, our approach to it, even though I'm privileged to try to help organize the program from my vantage point of a psychiatry leadership role, it's really about the whole hospital experience, including people in our emergency department and people in our family practice waiting room. So I think our sort of approach is to try to think about how can everybody have some way to take a breath. I think the last, it's interesting to talk about the last 18 months, many people in my building haven't had the luxury of taking a breath. And so it's also, I think, in many ways about, I don't know if this is Diane's experience in her children's hospital work, it's very much oriented towards patients and care providers, and with the recognition, I think, that if you're a healthcare worker or a staff member in a healthcare setting, anything and everything that can be done to make it, again, more beautiful and calming and less chaotic and frenetic, and also be a place where, the patients are getting some opportunity, which also might give you like a few minutes breath, because, the patient or client is getting a level of engagement, from another source. I think it really helps. So I think that all of those, I think for all of us, having opportunities to really prioritize engagement and learning and creativity, I think people much more expert than me have mentioned the benefit of that for the last 18 months. And I think hospitals are catching up in terms of that opportunity.
May I interrupt here?
Please.
Dr. Wiesenfeld, the coloring books that we do during the pandemic, there was, we create them just to give away to children in hospitals. But like I said, they're ages 0 to 100. And during the pandemic, nurses and doctors were so stressed that they were calling us to say, could we get some for the staff? Absolutely. And we had so many wonderful comments about how much they helped. Or the parents. Everybody was so on edge that anything that could be therapeutic or calming, and we wanted to do to help.
Yeah, I'm not surprised. I know, for myself in our hospital, especially back when we used to have music performances and a few more, the more interactive things, of course, before the pandemic created its restrictions. And, as simplistic as it sounds, there are a few things more lovely than being able to not only come across your own patients who are enjoying a concert, right, in a congregate setting in a hospital, but then to also realize that, as a physician or a nurse, or a service assistant, that you've been able to take a moment for yourself and also just not only watch your patient have that pleasure, but realize that you also stopped for maybe a minute or two and you stopped rushing and you didn't hear all the blaring code this and code that overhead, and you just watched a person maybe with dementia or other impairment just enjoy the music, and you allowed yourself to pause for a few minutes to do the same thing. I'm not surprised, Diane, and I'm hoping that once we have they're just about to come off the press. We're calling them maker kits, and they're sounds like similar to the work that you've done. And I have a hope / suspicion that some of them will find their ways into some of our staff's, kind of experience together with the patients that we've designed them for. I'm hopeful about that.
Well, we'd be happy to help.
Oh, thanks. Yeah, it's wonderful. It's been such a bruising time, so it's nice to think about doing that for all the staff. Sorry, Shaun, we just started.
No, that's terrific. Diane, maybe you might know, have you seen spaces that, because you're getting there with the different mediums, but have you, I once went to a Van Gogh exhibit in a cave where the entire space was immersive, which it sounds like you're almost getting to that stage with your CT lab setting. But have any healthcare organizations or other organizations done that as a way to give patients, employees, sort of a all sensory sense of change and meditation?
Well, I feel that since we started RxART, the thinking has changed so radically. People understand that healthcare is holistic. It's not simply about machines and medication, but it's your mind has to be in a good place. And I think other people do similar things, but no one is quite doing what RxART is doing, or RxART Canada. And we are trying to, and the artists love it too, trying to engage the entire space as in the transformation. So for the Murakami project, for example, we asked him to do the CAT scan machine, do the drawing for that, so that we could get a scan or a skin for it. And then we said, and all the walls, please. So the entire room is this magical place of smiles, of smiling flowers. And it's made such a difference. The kids comment on what a difference it is. The parents comment on how much more relaxed they are because their kids are relaxed. So anything we can do to activate the entire space, we're excited to work into.
It's amazing what you're doing, and so many possibilities and how that can be built into hospital and healthcare design. It's obviously, it's beyond, right, in terms of employers, and mental health is such an issue, even in the workplace. And we're all, of course, trying to convince employees, for example, to come back to work. But stuff we can do to make a setting more conducive to that, I think, is super important.
We're also working in a lot of mental health situations now. Especially COVID has so exacerbated that. And nothing RxART does the hospital pay for. Everything we do is entirely free to the hospitals. So, but definitely concentrating on mental health lately.
Well, I know I'm at the close to our time with our panel. With that, I want to thank our panel and thank you for our listeners to dialing into this session. It's super unique, and as we can hear, an ever expanding area, and almost wants you to sign up for our therapy program, even if it's not condition based, and or visit one of these MRI labs at one of the at the Children's Hospital. So thank you, everybody, for what you're doing. It's really amazing, and I hope it'll inspire other artists in hospitals and manufacturers to get behind, and clinicians to study it, to get behind this movement. So thank you, everybody.
Thank you.
Thank you.
Thank you.